Organism and external environment. Damaging action of barometric pressure. Changes in the barometric pressure may cause three kinds of damages to the organism. First, the most common nosological forms associated with influence of differences of the total environmental pressure on an organism. Second, diseases associated with a considerable change in the partial tension of gases. And third, slowly developing diseases of decompression origin caused by silent gas bubbles. Examples of these diseases are given in the table. This is the pressure chamber constructed by Paul Bert, who studied the influence of barometric pressure on a human, and for this reason he constructed this pressure chamber, and you see it on the slide. A human comes under action of lower barometric pressure in special pressure chambers or in the natural conditions on elevation to height. If a human elevates the mountains slowly on foot, the pressure reduces slowly and mountain sickness develops. In the table, it is shown how barometric pressure changes on elevation to the altitude. The higher the altitude, the lower the barometric pressure. Reduction of the barometric pressure is accompanied by rarefication of air and a drop of the partial pressure of oxygen in the atmosphere, that is, by hypoxia. Low partial pressure of oxygen in the atmosphere causes a reduction in the partial pressure of oxygen in alveoli and consequently in blood. You see that at the height more than 6 kilometers, oxygen does not enter the organism at all. The main pathogenetic factor of mountain sickness is hypoxia. Stages of acute mountain sickness. First, stage of adaptation or compensation, which is characterized by activation of mechanisms of emergency adaptation to hypoxia. And second is stage of decompensation, the disease proper. The stage of adaptation is characterized by activation of several reflex adaptive reactions in response to hypoxemia. There occur alterations in the functions of respiratory, cardiovascular, and other systems. All changes are presented on the screen. In elevation to the height more than 3 kilometers, adaptive reactions lose their efficiency, and the stage of decompensation begins with appearance of symptoms of acute mountain sickness. The symptoms are associated with development of hypoxia. Most sensitive to hypoxia is the nervous system, which is manifested by such symptoms as acute headache, dizziness, darkening in the eyes, narrowing of peripheral vision, disorders in evaluation of the distance, noise in the ears, disorders in olfaction, drowsiness, paleness, especially of the face, cyanosis of lips, disgust for food, nausea, pain in the abdomen, bloating of the abdomen, meteorism, severest vomiting, intestinal disorders, diarrhea. High fatigue, apathy, pain in different parts of the body, and also syncope. loss of consciousness, and even death. One of the mechanisms of adaptation to hypoxia is hyperventilation, which may have very unfavorable consequences shown on the screen. All these disorders arise from developing hypocapnia and respiratory alkalosis. If a person elevates to the same height rapidly within several minutes in open aircraft, the pressure changes rapidly. Hypoxia develops rapidly. That is why an organism has no time to adapt. That is, stage of compensation is practically absent. In this case, altitude sickness develops. The main pathogenetic factor of altitude sickness is hypoxia. Stage of adaptation is practically absent. Symptoms appear very rapidly. They consist in increase in the heart and respiratory rate, increase in the arterial pressure, dyspnea, feeling of emptiness on inspiration, headache, nausea, reduction in the acuity of vision, burning pain in the whole body, flicker or darkening in the eyes, prostration, fear of death, discoordination of movements, and death. Uncontrolled decompression is an unexpected drop of pressure in some closed space, for example in an aircraft cockpit or in a pressure chamber. This happens at the altitudes more than 10,000 meters. If the pressure drops faster than the air can leave the lungs, the phenomenon of explosive decompression takes place. It results from a sharp drop in air pressure in the aircraft or spaceship cabin in case of sudden depressurization. The result of uncontrolled decompression is barotrauma. Barotrauma is a physical damage to organs of the body induced by pressure difference between the environment, gas or liquid, and the internal cavities of the body. Damages affect tissue surrounding air cavities because gases are compressible, but tissues are not. If the pressure outside increases or decreases relative to the pressure inside, tissues of the body start to undergo deformation to compensate for this pressure difference. This deformation may induce trauma. Gases start to expand in the air cavities of the skull, severe headache, in the stomach, intestine, altitude meteorism, subcutaneous tissue, altitude subcutaneous emphysema. Changes which we described you may see on the screen. Action of high barometric pressure. Elevated barometric pressure is experienced underwater or underground. Caisson is a special enclosing structure that forms a chamber free from water for doing works underwater or in the ground saturated with water. The chamber is filled with compressed air which squeezes water out of the working space. The pressure in Caisson increases by 1 atmosphere with each 10 meters of submergence plus the normal 1 atmosphere pressure exerted on the surface of water. Periods of work in Caisson. First period is a period of compression, descent, characterized by gradual increase in the pressure above the norm. Second is period of work under elevated pressure, period of saturation. And third is period of decompression, ascent to the surface of water or earth, that is, transition from the zone of elevated pressure to the zone of normal atmospheric pressure, period of desaturation. Pathology of compression period. They are barotrauma of the middle ear and other air-containing cavities of the skull, in the frontal bone, upper jaw, ethmoid bone, and of lungs, eyes, teeth. The so-called diver squeeze develops, which is a pathological condition manifested by acute disorders in respiration and blood circulation. Pathology of saturation period. At high barometric pressure, the solubility of gases in body tissues and fluids increases, which promotes dissolution of additional amounts of gases inspired from the respiratory mixtures, with the result of saturation of tissues with gases with probable intoxication. Mechanisms of toxic effect of oxygen. They are inhibition of enzymes, in particular of oxireductases, by a high amount of oxygen, in result of which cells lose the ability to utilize delivered oxygen. Then production of free radicals and initiation of peroxidation of lipids of membranes and enzymes, with frustration of the intracellular metabolic systems. And finally, there exist two clinical forms of intoxication with oxygen, pulmonary and convulsive. Symptoms of oxygen toxicity. In the eyes are visual field loss, nearsightedness, cataract formation, bleeding, fibrosis. In the central nervous system, convulsions, cramps. In respiratory organ, these are jerky breathing, irritation, coughing, pain, shortness of breath, tracheal bronchitis, acute respiratory distress syndrome, and twitching in muscles. Toxic effect of nitrogen. At high pressure, body tissues are saturated with nitrogen. Nitrogen narcosis, which is nitrogen intoxication or depth disease, is a narcotic effect of nitrogen on the central nervous system, with depression of the higher functions of the brain, that occurs at depths more than 30 meters, in case of breathing with compressed air. At the depth 60 to 80 meters, there are noted excitement, unreasonable gaiety, which is called depth delight, disorders in memory, dizziness, reduction in the working capacity and in the intellectual abilities. At depth 80 to 100 meters, movements lose coordination. Visual and auditory hallucinations appear. At 100-meter depth, an individual falls into narcotic sleep, which may be followed by a loss of consciousness and death. Pathology of decompression period. If ascent is fast, nitrogen released from tissues and fluids has no time to be removed with respiration and may appear in blood and tissues as gas bubbles, which is the main pathogenetic factor of Cassoon disease. Cassoon disease, or decompression sickness, is a condition in which gases dissolved in blood and tissues start to evolve from them as bubbles and damage cell walls, blood vessels, and block the blood flow. Severity and symptoms of Cassun disease are determined by localization and extent of blockage of vessels with gas emboli. Manifestations of Cassun disease. First, itchy skin and pain in joints. Second, mottled skin, which is due to rupture of the superficial vessels. Rash may appear, small hemorrhages. Pain in bones and myalgia. Then, painfulness, crunch and crepitation in joints, sometimes edema of periarticular tissues. Then, in the labyrinth and middle ear, expansion of gases and hemorrhages occur, accompanied by disorders in the equilibrium, by nausea, vomiting, deafness, and Meniere's syndrome. Then, transient or persistent cerebrospinal disorders, paralysis, paresis, disorders in sensitivity, in coordination, and so on, dizziness, headaches, speech disorders, confusion, stupor. Principles of treatment of Cassun disease. They consist in, first, gradual decrease in pressure to the atmospheric level. Second, temporary prohibition of staying at low atmospheric pressure, for example, of flights. And third, use of gas mixtures with high percent of oxygen for decompression. Effect of ionizing radiation. Acute radiation sickness. Biological effects of ionizing radiation may be of two kinds: deterministic effects, which depend on the dose and occur are induced by radiation dose exceeding 100 rads or 1 gray, and stochastic effects, which do not depend on the dose and have no threshold doses. Deterministic effects may be somatic, including acute radiation sickness, chronic radiation sickness, clinical registered frustration of hematopoiesis, skin and tissue burns, alopecia, ray cataract, temporary or constant sterility. Stochastic effects may be somatostochastic and genetic. Somatostochastic effects include carcinogenic effect and teratogenic effect, and genetic effect includes genetic mutations and chromosomal mutations. On the molecular level, two mechanisms of action of ionizing radiation are distinguished: direct and indirect. Direct mechanism consists in rupture of molecular bonds at the moment of irradiation, the phenomenon called ionization of molecules. The bonds are ruptured in organic and inorganic molecules, and first of all in the molecule of water, which is called radiolysis of water, with formation of free radicals. Indirect mechanism is associated with further action of formed free radicals, which start to interact with structures of cells and damage them. Forms of acute radiation sickness. They depend on the dose of irradiation and are presented on the screen. In the clinical picture of radiation syndrome, several syndromes are distinguished, which are presented in the table. Degrees of severity of the disease. First degree, which is mild form, It is caused by radiation at the dose 1 to 2 gray. Second degree, moderately severe form, is induced by 2 to 4 gray irradiation dose. Third degree, severe form, results from the dose of irradiation 4 to 6 gray. And fourth degree, highly severe form, results from an irradiation at the dose 6 gray and more. Marrowy form has certain periods in development. First period is period of initial reactions, called prodromal phase. The second is period of deceptive well-being, or latent period. The third is period of evident clinical symptoms, and the fourth is the period of recovery. On the slide, you see the periods of acute radiation syndrome. Now, we speak about the effect of changes in temperature on an organism. Disorders in thermoregulation are manifested in two states, hyperthermic state and hypothermic states. Hyperthermic states include fever, hyperthermic reactions, hyperthermia. Hypothermic states include hypothermia as such. A human belongs to endothermal, warm-blooded animals that are capable of maintaining the temperature of the body at the constant level, irrespective of the ambient temperature. The body temperature is maintained constant by physical and chemical mechanisms of thermoregulation. Chemical thermoregulation is activation of metabolism with a resultant increase in heat production. Contractile thermogenesis includes increase in the tone of skeletal muscles to provide position of the body, limiting dissipation of heat. Muscle shiver, which is the most powerful mechanism of heat production. Non-contractile thermogenesis is realized by exothermal metabolic reactions in skeletal muscles, liver, heart, kidneys, gastrointestinal tract. Physical thermoregulation is a complex of mechanisms providing dissipation of heat. Physical mechanisms of heat loss are convection, radiation, evaporation, conduction, hypothermia. In other words, it is overheating. It consists of stage of compensation and stage of decompensation. Stage of compensation is adaptation to hyperthermia, and it is characterized by activation of mechanisms of emergency adaptation aimed at increase of heat dissipation and limitation of heat production. Stage of decompensation of hyperthermia is characterized by breakage and non-effectiveness of thermoregulatory mechanisms, by derangement of temperature, homeostasis, and by a significant rise of body temperature. Heat stroke. It is a special kind of hypothermia, and it consists in a rapidly developing overheating of the body with the temperature rising above 40 degrees Celsius. Symptoms include rise of body temperature to above 40 degrees Celsius, headache, nausea, vomiting, coarse muscle tremor, confusion, loss of consciousness, no sweating, hyperkalemia, tachycardia, arrhythmia. The symptoms may be complicated by hypovolemic shock, disseminated intravascular coagulation syndrome, rhabdomyolysis, lactic acidosis, liver and kidney failure, cerebral edema, pulmonary edema. Sunstroke. Cause of sunstroke is a direct action of energy of sunlight on an organism. The leading role is played by damages to the CNS, arterial hyperemia of the brain that progresses into venous hyperemia, disorders in metabolism. The factors of arterial hyperemia of the brain are increase in the brain temperature under action of the infrared spectrum of the sunlight, and in biologically active substances produced directly in the brain tissues, kinin, adenosine, acetylcholine. Arterial hyperemia enhances blood filling of tissue, which compresses the brain matter. Increase in lymph production further compresses the brain, including venous vessels and sinuses. This in turn hinders outflow of venous blood with the resultant venous hyperemia. Venous hyperemia leads to hypoxia of the brain, to brain edema, and to small focal hemorrhages into the brain. Disorders in the circulation combine with disorders in metabolism, in energy production, and in plastic processes in cerebral neurons. Hypothermia. Hypothermia, or overcooling, is a condition of an organism when the body temperature drops below the level required for its normal metabolism and functioning. In hypothermia, body temperature falls below 35 degrees Celsius. Hypothermia passes 2 stages of development. First stage is compensation, which consists in enhancement of heat production and limitation of heat dissipation, due to which the body temperature is maintained at normal level. And second is stage of decompensation, when heat production is no longer effective, heat dissipation predominates, and body temperature drops. The stages of hypothermia may be mild, moderate, severe, and profound. These stages are determined by the temperature of the body core. Mild stage occurs at the body core temperature from 35 to 32 Celsius. It is manifested by anxiety and by very strong shivering. Moderate stage. It develops at the temperature of the body core from 32 to 28 Celsius. It is manifested by a reduced level of consciousness, by reduction in shivering, by loss of motor control, loss of coordination, and by cyanosis of lips. Severe stage occurs at the body core temperature from 28 to 20 Celsius degrees. It is manifested by unconsciousness, stoppage of any shivering, by rigidity of muscles, by potential arrhythmias, and finally by cardiac arrest. And a profound stage results from reduction in the body core temperature to below 20 Celsius degrees, and it is characterized by absence of any signs of life. Thank you for your attention.